Welcome to my podcast. Today I'm going to talk about another common case that you can face in the clinical setting or generally speaking in the lifetime. So basically, after you introduce yourself, double check the patient name, date of birth. The patient usually they are men in certain age group, which between 20 to 40, and they will tell you, doctor, I'm having hard time with the smell. I was getting sweating, and I have really malodorous smell, especially under my armpit or in the body folds, and I just need a solution because this is getting on my nerve, and it's just embarrassing. Can't stay in the workplace, and people started to notice. And he might say that I noticed that my armpit and the axillary hair looks like it's fluorescing. So I just wanted to know what's going on. Though I clean, I want to know what can I do to stop this embarrassment. So you will ask some questions. Say, for instance, if you have any past medical history, if you have any thoughts, what might be the issue, how long ago did you have that, how it was your puberty, those kind of questions, just probing about finding if there is any specific thing or any reasoning for that. And you will say, do you have any specific concern and anything that it's bothering you? As I stated, he say the workplace and the smell and the surrounding that he notes that's getting on his nerve. And apart from that, he's otherwise fit and well and have no history of any note. So after you ask it all of that, just you need to ask about the lifestyle, for instance, drinking, smoking, eating habit, and if there is any physical activity, and if there is any family history with the same problem, whom he lived with, and when he mentioned the work, just you need to know what sort of work does he do. Is it a manual one? Is it an office one? Something like that. And then you'll ask him, okay, we need to go to the top of the issue, and I would like to have a quick look if that's fine with you, and you will ask if there is a need for a chaperone. And while you're examining that, you will notice that the axillary hair and sometimes even the pubis might show like yellowish, whitish material, and any hair-bearing area in other region, it could be affected and it could be not. And if there is the facility of the wood lamp, you need to examine that in order to see the fluorescence, because the wood lamp will show this thing. And then you will try to discuss with the patient what's your differential, whether it's fungal infection, whether it's bacterial, whether it's pedra, whether it's lice, those kind of things which relate in that area. And you will, the first differential in that condition usually, something called trichomycosis axillaris, which is a superficial bacterial infection that mainly affect the axillary hair, and as I mentioned, can affect any other part of the body like pubis. And he will ask if there is any itching, for instance, or scales, in order to differentiate from other skin condition. Sometimes it can affect also the scalp, the eyebrow, the eyelashes, but mostly in the area which is dominated by hormonal changes, which is basically, as I say, the axillary and pubis. However, others can't be free of this issue. Many of the misnomer for this kind of condition, which is can happen in certain age group of men, they might think that this is a fungal infection, and they might start treating it with antifungal medication, which won't help at all. It's, as I mentioned, it's a superficial bacterial infection, which called Corynebacterium or Serita, which can react with the area and cause this kind of malodorous smell because it reacts with it and will cause the characteristic feature of the yellowish and the whitish reflection or illumination with a granular nodule, and it's like a concretion adhering to the hair follicle, to the hair shaft, but it's not, in comparing to, for instance, lice, it's easily scraped off, so if you try to remove it, it's detachable, while in case of lice, it's not, because it will be stick to the hair shaft. And the acid odor is the common manifestation of that kind of condition. And as I say, because the bacteria in that area would be tightly packed and proliferating in the fold area, which is intertriginous hair-bearing area, and yelling in this kind of smell due to the auto-inoculation, and it could affect any other part of the hair-bearing area. It has been found it's mostly in men comparing to women, because women usually tend to remove their axillary hair by different ways. And of course, one of the other contributing factor, if it's, for instance, a hot environment, high in humidity, that's one factor. Also, if the patient has poor hygiene, and if the patient has, like for instance, some people, they have excessive sweating in that area, or if they are obese, they will have a lot of body fold, which will harbor the sweat, and sometimes as well super infection with bacteria and fungus. And you will ask if there is also underlying diabetes, which could favor proliferation of this kind of bacteria. So after you just told the patient about your differential or your provisional diagnosis and backed up with the Woods lamp, you will think about other differential, like I say, fungal hair shaft infection, pedra, so for instance there's white and red pedra, which present with different fluorescent, and they have different presentation, which is usually loosely adherent to the hair shaft. And also the Woods lamp will yield a different fluorescent. And the other one, as I mentioned, is lice, pediculosis, which is of course it's intensified by the itching. And you will see, of course, the oval egg, which is sticky or sticked to the hair shaft, and it's difficult to remove. Another condition you could consider in that situation, if the patient says it's very offensive smell or malodorous, it's hydritis suppurativa, which is another condition with deep nodule, boil-like structures, and abscess, and it's always there is like fluidy and abscess coming out of the area. It's tolerant, boggy, and has sinus formation, and usually there is scarring. So this is another condition should be treated, should be considered. And the treatment on this kind of condition, when you rule out the other differential, is basically tell the patient the hygiene is very important, so you need to shave the area in order to help with the healing process. If there is a need for a topical or oral antibiotic, that's something you need to your clinical judgment to decide. It might be recurring if the patient is not taking good care of their hygiene, and if the patient is living in a very humid or wet place. So if the patient has a lot of sweating, because sweating is personal experience, some patients, they or some individuals, they sweat more than others. So in that condition, you will consider a solution which is called aluminium chloride, which is can work in certain situations. Just need to explain to the patient how to use. So I need to basically to wash the area, clean it, dry it, and then apply the solution. And usually they do it overnight. And keep repeating it, and you will notice some decline in the sweating. And also using some antiseptic washes in order to get on the top of the issue. And this is something that you need just to discuss and see if the patient is happy to try this and take it from there. Also, you can advise about wearing cotton cloths, which will help in the absorption of the humidity and the sweat and make the skin clear and dry. And there is nothing, you just need to red flag the patient always if there is something like, if something doesn't seem right, if you feel the infection is increasing, and if you are not improving, if the pain increasing, those kind of thingy, you need to tell the patient, you need to come back to us, and we take it from there. So by that, I hope that I discussed and draw your attention to one of the commonest cases that you could meet or see in the clinical setting, and how you can get into the top of the issue. Thank you.